Hello everyone, my name is Dr. Samanth and I'm a consultant psychiatrist associated with Mindful TMS Neurocare Centers. Each year, October 10th is marked and celebrated as World Mental Health Day. So this year, our team at Mindful TMS have collectively made an effort to discuss the issues that have been most relevant in the recent times, particularly related to mental health. We live in a time where the use of technology has become so pervasive and pertinent that it practically colors the majority of our actions. With the advent of smartphones and its ever-evolving capabilities, its use has increased exponentially in the last decade. It is expected that there will be around 760 million smartphone users in India by the end of next year. Particularly during the recent times, the COVID era as we call it, the time spent on the use of smartphones has increased drastically. While we do acknowledge the multifunctionality and importance of technological devices like the smartphones, we at Mindful TMS have been incessantly receiving concerns related to the smartphone use. While on one hand we encounter patients who have been facing psychological issues due to the increased smartphone use, on the other hand it is not uncommon that the increased smartphone use is a manifestation of some other underlying psychopathological condition or it is a coping strategy. While the increased usage may not always be detrimental, we have constantly been hearing about interpersonal and intrapersonal issues that have arisen due to excessive use of smartphones. Also, I would like to categorically emphasize here that it is not the increased usage that is always the problem, it is rather the pattern of use that needs to be carefully attended to. So, I am going to talk about the implications and the manifestations of the excessive or problematic smartphone use. What may just appear as a problematic smartphone use might result from an underlying disorder or a coping strategy. For individuals who might be suffering from depression, smartphone use might become a way of relieving their dysphoric mood as well as feelings of isolation and loneliness. Frequently, excessive smartphone use can also be an escape mechanism perceived as a means of decreasing awareness about negative feelings, the tension as well as pain. Compulsive tendencies, often manifested as ritualistic behaviors, can lead to repetitive checking of the smartphone as a means to enhance immediacy and predictability. Individuals with low self-esteem, insecure attachment, and anxiety might use social networking, instant messaging, and calls for accessing reassurance. Individuals suffering from health anxiety might use the smartphone to constantly access health-related information, read about different disorders, and verifying the symptoms. The aggressive traits, decreased self-control, impulsivity can translate into cyberbullying, online aggression, and excessive smartphone use in appropriate contexts like official meetings. Even in isolation, excessive smartphone use can be problematic if it is associated with loss of control and withdrawal-like symptoms that are often considered as hallmark of addictive behavior. So having said this, how can we make out problematic smartphone use? Have you been spending excessive time on the device that there have been multiple unsuccessful attempts at limiting its usage? Is it that you feel the urge to use your smartphone again right after you stopped using it? Do you feel that you are neglecting other responsibilities because of use of smartphone? Are there any scenarios wherein you are unable to keep up with appointments? Do you miss out on planned work? Are you finding it difficult to concentrate? Are you thinking about smartphone use even while you're not engaging in it? Do you experience any sort of incapability of doing anything without a smartphone that is feeling helpless? Do you experience an unpleasant state if the smartphone use is discontinued? You may feel impatient, fretful, depressed, anxious, or oversensitive when you are not able to use your smartphone. Have there been any conflicts with the family members or other loved ones who constantly tell you about your problematic smartphone use? Having said this, I would want to emphasize here that we should carefully guide against pathologizing everyday behavior. And as I said initially, not all smartphone use is bad. My aim of today's discussion was to make the listener more vigilant and attend to the potentially harmful smartphone behavior which may be related to sustained harm, distress, and functional impairment. If you feel that your smartphone use is interfering with your functioning and needs attention, I would advise you to contact a mental health professional. Namaste.